it might be worthwhile to use the demo op for something as minor as a handpiece burr change. When I observe TDOers working, this is what we frequently see is endodontists changing their own burrs, both before the treatment and during the treatment, which is a very inefficient way to work. It breaks your focus, and it's possible to do a burr change with your assistant much more efficiently with much less interruption in the procedure. I have many tapes like this. I can show many TDOers doing this. Doesn't mean they're bad clinicians. They're certainly very fine clinicians, but this is a very inefficient way to work. And it's so easy to learn how to do a burr change with the assistant efficiently in a way that doesn't break your focus and just lets you to continue to work normally and efficiently. I think most clinicians are probably unaware of how disruptive this really is to your focus and efficiency doing this yourself. So let's see if we can't use maybe the demo op to maybe go over just a few of the fine points in just something as minor as a burr change. There can be many facets of endodontic treatment where the same principle kind of applies, where there's an interruption of focus, an inefficiency added, and it's completely unnecessary. It's possible to do this very efficiently without breaking any of your concentration or focus. So let's use the mix effect in the demo op and kind of see. This is obviously it's not restricted to the United States. This is in France. Another pretty good example of very disjointed ergonomics, reaching, having the endodontist really not use the assistant very efficiently. So if you just count the number of class 4 and class 5 motions there, it's pretty revealing. So from the demo op, using the mix effects, you can see different views of a burr change, so you can see how this actually occurs from multiple different angles all at once. So a few of the smaller nuances. There's a lot of small nuances in all of these things. First of all is just the hand pass of the handpiece. It's done in a very specific way, so there can be no mistakes in the passing of it, either to or from. It's a very defined and distinct action that Joy knows exactly what it means. So this has to be practiced over and over again. So these motions are very discrete. They have very specific meanings. There's a class 3 motion to the handpiece. I hold it up vertically and then flip it down. Joy knows exactly what that means. From another angle, hold it up straight, flap it down, and then she knows to come in and get the handpiece. And notice her hand grip there, so there can be no mistake in who has control over the handpiece. And then the universal hand signal for return of the handpiece. So a lot of little nuances, and I think the demo app, when we have the postgraduates here, will really bring it to light as you photograph yourself doing this. It becomes really obvious what all the differences are.